The American Heart Association is one of the leading organizations dedicated to excellence in stroke and STEMI care, among other things. And they have a Mission Lifeline EMS Recognition program that encourages excellence in pre-hospital care for the things that we can affect on stroke and STEMI calls. In the past, Lifestar has participated in this program, and we have received both a silver and a gold award previously. Our participation dropped off. A lot of things happened, COVID among other things, but we are now back to submitting our data to the AHA to see if we meet the minimum criteria for an award for Mission Lifeline EMS. Here are the criteria. You can hit pause if you want to read each individual criteria, and along the right side are the different levels of award that you can receive. For gold, you have to have compliance of 75% at the annual level for all the required measures, and you have to have received either a silver or gold award in 2022. For silver, you have to have the annual compliance of 75% for all the required measures, but you are not expected to have won the award in the previous year. And then for the bronze, at least 1/4 of compliance of 75% or better. I'm going to show you the numbers. I'm going to show you how we got the numbers, and I'm going to tell you how it is that you affect our ability to qualify or not qualify, because this is really all about you. You might be asking, why should I care if Lifestar gets an award? Well, getting an award is a nice thing. It's nice to be recognized for excellence. But much more important, the communities that we serve are always looking for evidence of the level of care that we provide. And we are being observed by the fire departments we respond with, by the hospitals we go to, by the state as a whole. Everyone is watching to see the level of care we provide. When we get recognition, this is concrete evidence based on actual data that shows that we meet criteria for excellence in pre-hospital care in various categories. So it's important to Lifestar, but it's also important to you, because these are the communities that continue to decide if we should provide their 911 service. That is directly related to whether or not you remain employed in that particular area. And it also affects our general reputation. And as some of you go on to other things, you're going to come from an organization that has been recognized for excellence. So please take it seriously, and please take our suggestions to improve the quality of care that we provide and improve our documentation of that quality care. You're looking at the American Heart Association's Quality and Certification Tool. This is the gateway that Lifestar enters the data for 2023 to see if we qualify for EMS Lifeline Recognition for excellence in pre-hospital care for the 2024 season. Because you're watching this on video, I know you can hit pause, so I know you can look at the individual numbers and analyze them yourself. So I'm simply going to show you the criteria and talk about why we did or did not meet those criteria. If you meet the criteria in all 4 quarters, that's 75% or more for all 4 quarters, you're eligible for silver or gold recognition. If you average 75%, even though you may have dipped below 1 quarter, but all the other quarters you were significantly higher, you still are eligible. But if you did not average or meet the criteria for all 4 quarters, the next level will be bronze recognition, and that means you hit 75% or more for at least 1 quarter. And you can see right here that Lifestar is ruled out for silver and gold recognition for 2024 because of the very first measure here on stroke pre-arrival notification. How we calculate this number is I run a report from ESO, and we only look at stroke calls, primary and secondary impression, which you documented, for 18 years or older that you also transported. So if somebody went by private vehicle or refused to go, that doesn't count here. And it looks at whether or not you documented a stroke alert. In the flowchart, there is a stroke alert, and we strongly urge you to use that for documentation, because that's what the report is looking for. For those that are interested, this is how we go about printing the report to find out if we meet the criteria. And right here we have the pre-hospital stroke alert on cases that you say were a stroke. I'm going to click on the filters tab so you can see exactly how it finds these calls. They have to be locked calls. Active means that we didn't duplicate a call and we deleted one from the system or marked it as inactive. Your primary or secondary impression has to be stroke or a TIA. It needs to be an emergency or a 911 call or an emergency pre-hospital call. We have to have transported the patient. There were some in here that did not want to be transported, so those are filtered out. And then the patient must be 18 years or older. If we run those for 2023, you'll see that we have a total of 137 patients. But those of you who did the math on the video so far noticed that it was actually 133. The reason why these numbers don't agree is because in 4 cases, you documented this as an emergency pre-hospital 911 call, but then you picked the patient up in a hospital or in an emergency department. That is not a pre-hospital 911 call. That is an emergency interfacility. Still, under the 137 calls, 21% of the time we actually met the criteria. So when we look at the bottom, we can see 29 times out of 137, you met the criteria. For 108, I had to click on each one of these and read the narrative and see, did you document in the narrative a stroke alert, or did you even document in a narrative a pre-hospital report, either by cell phone or radio? So for all the calls that we didn't make the criteria, it's because you did not document a stroke alert in the flow chart, and you did not document a pre-hospital report of any kind. And the rule is, if you don't document it, it didn't happen. So that's how we go about generating the report, and this is why it's so important that you use the flow chart so ESO recognizes that something happened. So all these calls that do not meet the criteria are calls in which you did not document a stroke alert and you did not even document a pre-hospital report of any kind. That's a problem because the rule is if you didn't document it, it didn't happen. So the assumption for all the rest of these reports is you did not even tell the hospital you were coming. Fortunately, in 1 quarter, we still are over 75%, so we are still eligible for bronze recognition here. Second measure is, did we document a last known well time? And you'll notice the 1st quarter is pretty low, but we still meet 75%. That's a reflection of the fact that I turned on in ESO the requirement that if a primary or secondary impression is stroke, it forces you to fill out the form for Cincinnati Pre-Hospital, and that includes the onset of the symptoms and last known well time. Third measure, the numbers are fairly good across the board, and that's, did we get a glucose on stroke patients? The next measure is, did we do a stroke screen? We did it in all 4 quarters, quite high percentage. And then we move to the STEMI measures. There are 3 STEMI measures. The first is, did you do a 12 lead in 10 minutes or less on any chest pain or suspected MI calls? You would expect those numbers to be quite a bit higher. And the problem is not that you're not doing 12 leads. The problem is you're not doing them in 10 minutes or under. And this can be corrected by making sure you bring the monitor in on chest pain calls. The next one is aspirin administration if there is a positive STEMI. And here we meet the criteria in all but the 4th quarter, but we only missed it on 1 patient in the 4th quarter. But because there were only 3 STEMIs in that quarter, it drops down to 66%. And the last one is, did you notify the hospital when you had a positive STEMI call? In this case, we have 100% on those calls.